Hello everybody, my name is Brady Huang. I'll be spending the next 45 minutes talking to you about the flexor and extensor tendons of the wrist. I'm going to divide this discussion into two parts. We'll first talk about the dorsal aspect of the wrist, the extensor compartments and extensor retinaculum, followed by the volar aspect of the wrist, the flexor tendons, the carpal tunnel, and the various spaces that exist along the volar aspect of the wrist. It's important to recognize the anatomy at the dorsal aspect of the wrist, and more specifically the extensor retinaculum, which is a distinct thickening of the antebrachial fascia. That's the fascia that encircles the entire forearm. And this distinct thickening, as can be seen here on the sagittal cadaveric section, is what helps keep the extensor tendons closely applied to the dorsal aspect of the wrist, giving them a mechanical advantage during wrist and finger extension. Likewise, we can see here on a sagittal corresponding MR image, you can see its relationship, its fusiform nature, with the underlying extensor tendons. Here a cadaveric cross-sectional image also showing the extensor retinaculum nicely, the fibrous white tissue representing the collagen fibers, and you can actually see that there are portions of the extensor retinaculum which are formed deep to the extensor compartments. These are referred to as the infratendinous retinaculum, whereas the more superficial components are referred to as the supratendinous retinaculum. And one more thing that you may observe on this image is that this extensor retinaculum is in fact continuous with the flexor retinaculum of the wrist, again being a distinct thickening of the antebrachial fascia of the forearm. Likewise, you can see this on MR imaging, the corresponding MR image in this cadaver, and you can see particularly over the fourth dorsal extensor compartment that this extensor retinaculum is very well formed, where it measures up to 1 to 2 millimeters in thickness. Now, the extensor retinaculum does have several osseous attachments. They're referred to as the septal attachments that help separate the extensor tendons into their various compartments. So as we go from radial to ulnar, there are 6 distinct dorsal extensor compartments, starting with compartment 1, abductor pollicis longus, extensor pollicis brevis, compartment 2, extensor carpi radialis longus and brevis, and then we'll pass over this bony landmark or hump referred to as Lister's tubercle. This is an important landmark. We'll find the third dorsal extensor compartment, or extensor pollicis longus. Next to that, we'll find the fourth dorsal extensor compartment, extensor digitorum communis and extensor indicis proprius. Next to that, the extensor digiti minimi. And finally, in the ulnar groove, the sixth extensor compartment, or the extensor carpi ulnaris tendon. And if you're trying to remember these tendons and keep them straight in your head, at least the first 3 compartments, you can use the mnemonic longus, brevis, longus, brevis, longus, because they go in that order if you use the first letter of the last name of the tendon. And this works as a palindrome in reverse direction, so longus, brevis, longus, from ulnar to radial. So that helps you remember. I would use that mnemonic. Otherwise, you can always just pull out the anatomy book or look it up on the internet. There's plenty of resources to help you figure out which tendons are which. So we're going to start out with the first dorsal extensor compartment comprised of APL and EPB. These help to abduct the wrist and the thumb. The first bony septal attachment of the extensor retinaculum is just radial to that.